My name is Janice Hansen. I am a co-facilitator of the Colorado Cancer Coalition Survivorship and Palliative Task Force. And I'm very happy today to welcome Jen Currin-McCulloch, who is an assistant professor at Colorado State University and a wonderful oncology social worker, and has done quite a bit of research with regard to the experience of young survivors. And so she's going to be sharing some of that with us today, and we'll be sharing her slides. This program is going to be recorded along with a PDF of her slides and posted on the Colorado Cancer Coalition website in about 10 days, 2 weeks. So Becky is going to post a link to that address so that you can find that a little bit later if you wanted to view it later on as well. So without further ado, welcome, Jen. We're so excited to have you with us and hear about your research and your experience working with young survivors dealing with cancer.
Thank you so much, Janice and Becky, for having me here. It's an honor to be here and talk about doing work with AYAs, adolescents, and young adults with cancer. This is kind of my life work and mission. I worked for 20 years the bedside in oncology and palliative care, and got a bug to go back to school and see what I could do to help improve the psychosocial quality of life of AYAs as they're going through treatment and through end of life. So this is a broad spectrum. So do recognize, I know that it's a lot to cover, but I'm getting on key points, and I really wanted to emphasize end of life and how to help AYAs and their families prepare for that, because I think it's something that we kind of skirt over for fear of maybe we will be decreasing hope by talking about death and dying with this population. So I'm going to plant the seed that maybe it's important that we do start talking about advanced care planning discussion topics with this population, because they are interested in having control over their life from diagnosis through end of life and bereavement for their loved ones. So bear with me for this broad range. Hopefully I can make it interesting and fun. So I always like to acknowledge my funders. My research was initially funded through the American Cancer Society through their social work dissertation program. So my group work I'll share about with you that I do now is funded through the International Association of Social Work with Groups. And my research has also been funded by the PEO Scholars, which recognizes women researchers. So my objectives for us today are to talk about some of these biological and psychosocial aspects of cancer for AYAs that makes it unique in this population. What is existential quality of life, and what is it in this group, and why is it important that we talk about existential quality of life? I want us to delve deeper specifically into existential quality of life in young adults that have advanced cancer. And we can look at why it's important to talk about advanced care planning kinds of discussions with this population. And lastly, I'll share some resources that I know about that might be kind of fun for you in your different aspects and where you work. So if you want in the chat, I always like to know what spurred you? What spurred you to join from Israel or from Canada or from across the US? What about this topic is drawing you here today? If you want to share that in the chat, I think we've got your names. And two, if you want to share what kind of setting you work in. Is it healthcare? Is it inpatient, outpatient? Is it support services? Great. Community, psychosocial, great. And I hope that there will be enough information here that talks about support services, but also some health kind of information as well. So stuff to reach everyone. 10 years doing bedside, great. AYA-based nonprofit, great. Well, you'll see on the side, oh, Gilda's Club, great. An underserved population, yes, I totally agree. And that's why my heart is here. Great. And ovarian cancer, I got to include some young women with ovarian cancer in the work that I do. And I've learned a lot from them about being a young adult in this group. MSW student, great. Great. Cancer support community in LA. I love it. I love where folks are coming from all over. Well, great. Feel free to keep jumping in. I will keep rolling on our topic to keep us moving. So this, as many of you know, it is a rare population. Although it is only 4% of the population of those who are diagnosed with cancer in the US each year. It may be different for those in different countries, but my guess is it's probably similar. So in the US, it's 89,500 AYAs between the ages of 15 to 39 were to be diagnosed in 2010, while 9,270 AYAs will die from cancer in that same year. It is the leading cause of death, a leading cause of death for males and females. So it's kind of bounces back between 1 and 2 based on accidents. And so interestingly enough, other populations, as you all may be aware, we're starting to see survival rates are going up. People are living longer with cancers, but this population is one that has seen very little improvement since the 1970s. So why that might be, if you are into interesting research articles, I will include my references in the PDF, you'll get those, but this interesting work by Blyer, Archie Blyer does a lot that looks at why is cancer so unique in this age group? So a lot of it has to do with really the whole body and physiology of folks in this age. So when we start to provide treatments to them, they have different bodies, right? So their fat tissue is different, as they're growing, they're getting taller, they have different, adipose fat tissue in different places, right? The hormones are changing. Also going through sexual maturation. So how the chemotherapy is absorbed and metabolized or processed is very different based on this age group. There are also a lot of social factors, right? So at this age group, many folks don't have insurance. Before the Affordable Care Act, obviously, a lot of folks didn't have it, but now that's helped some. But folks being able to keep their insurance to go for follow-up treatments, also moving a lot. Not really having a good understanding of what the healthcare system is or having efficacy in being able to manage all the different layers of the system. They may be knee deep in schooling and work and can't take time out to have that appointment to figure out what's going on. And so they're also building these social intimate relationships that can be impacted by their treatment. And they may want to, I saw a lot in practice, that folks want to continue on with parts of these lives that give their life meaning and joy. And so they altered their treatment some. So they would take less medications that gave them headaches. They would move their chemotherapy appointments or not show up based on something they had that's important. Also, the aspect that we all know in this age group is that many folks think I'm too young, I can't be sick. This symptom, it's just, I'm just tired. I heard from a lot of young adults, well, I was carrying my backpack. I was walking a lot across campus. I was cutting hair and standing up. I was, thought it was because I was just so tired. And then many folks, obviously, at this age, young age, might not have had exposure to a traumatic event. So it might not have developed these adaptation or coping skills to know. So all of these factors come into play, and looking at how young adults and adolescents identify as a cancer survivor. Many folks have a sense of appreciation, unlike folks in their age group, right? That life can be precious. They have a lot of personal growth. A lot of folks, when diagnosed with cancer, you may have met, change their life course and direction. They want to become nurses or doctors or cancer survivor advocates. And there's this identity paradox, especially in this pivotal developmental milestone time in their life, where a lot of folks have this pre-cancer identity. They have who they are as a cancer survivor, but they also have this patient identity, and it's trying to figure out when does which identity come out, when do I bring which out, and when do I hold back on some of them based on what other people feel they need or where they're comfortable in a social setting. So there's often a lot of isolation and purposefully removing oneself from settings where it's uncomfortable, as you can imagine we all would, right? So it's really important to help them build family, friends, healthcare provider networks to support them in feeling like they have a sense of connection with others. And most importantly, I think, is connecting to other AYA survivors. So I've done a lot of work on hope, but interestingly enough, paralleling or balancing hope is this constant sense of disorienting grief. Like every aspect of their life they knew before is no longer there. So you wake up, a lot of folks describe it as being, dropped on a desert island with a map, and one other person, and either the map or the other person are of a language that they understand. Um, I had another person describe like their life after diagnosis was looking down on a whole bundle of Christmas lights, and everything, all of aspect of their life was just bundled up in one big knot. As you all know how fun that is, or any type of light or necklace that gets bundled up. Like they're not a part of it. They don't know how to manage all of this stuff. So it reaches every aspect of their lives. This is why it's so disorienting, right? So we're looking at, they've lost their sense of the vision of their whole world, right? Where their future, where their dreams might go. A lost sense of innocence, and this invincibility is now gone. I talked about their identity in both physical and social realm, but their sense of purpose and meaning. Also a sense of feeling broken, both physically and mentally. And that they, the body that they trusted, the mind and emotions that they trusted would be there are not there. Loss of fertility was huge and continues to be huge in our work that we do. Loss of time to enjoy the things they want. Lost life. We talked about the number of AYAs that die from cancer every year. Lost friends who are dying from cancer as well, in a sense of survivor guilt, and a lost sense of hope. We know that AYAs, even though they are dealing with all of these, they grieve in developmentally appropriate ways. They lose a lot of this critically important peer support to help them understand how to navigate this, because their peers don't know what it's like. They often suffer in silence. Many of the folks I talked with had never met a social worker, which I thought, oh my goodness, how could you have not met a social worker, let alone a psychologist or a psychiatrist? We have shortages in our country. It is a part of the healing process that's not seen as important in terms of funding and resources. So helping them to reach out to support. They know about their sense of mortality. They feel it, and they want to find ways that they can be remembered and do legacy work. Even at 13 and 14, they want to be doing legacy work so people remember them. And they want to protect their loved ones. So I'll talk a lot about meaning and illness, because that's really what gets me up every morning. So existential quality of life, right? Always seems like a big, broad term. What is that? In my mind, existential quality of life is what motivates us, what gives us a sense of feeling and connection to the world. And I think it's something that is so important to talk about, because it is the reason why folks don't come to treatment, or they do come to treatment and live beyond what their scans and their labs tell us for a special event, for a special connection. This is what drives people to be who they are and to the day-to-day world. So you see my energy about it? I think it's important. I hope you do too. But looking at hope, meaning making, and a sense of connection. I'm going to share this in reference to work I do with with young adults, in particular 18 to 39, who have an advanced cancer, so stage 3 or 4 cancers. So I asked them to share with me about their hope across the timeline, with the points where the axis meets, is, where they're diagnosed. So they take me on this path of highs and lows around their course of treatment. Interestingly enough, most folks draw their hope straight across the timeline. So they say that their hope, they continue to have hope. The types of hope may change, and we'll talk about that reframing of hope. But what changes for them is joy. And so I thought that's really important to recognize that hope is always there, almost always there, maybe not right at the time of diagnosis. But for most people, there is always some type of hope. It's the joy that we need to be able to help. And I think that's related to sense of meaning. So I'm not going to read all of these to you, but this is a cool framework for looking at hope. And it's something you could identify in the work you do with AYAs too, to ask them, like, what are you hoping for your health or your mental health? So interestingly enough, and maybe just because it was obvious, but cure doesn't come up as the first thing. What usually typically comes out of folks' mouth first is having treatment options and reducing side effects. Um, Being able to be in a point of remission or time without treatment is also important. But many of these folks recognize with an advanced cancer that a cure probably wasn't possible. So they were looking for maybe a way to reduce the symptom burden mostly. So what they wanted in terms of relationships with others was to have this supportive, intimate relationships. As you can imagine, dating is super challenging once you have cancer, and dating once you have an advanced cancer and are on chronic treatment or maybe are on hospice care is virtually impossible. So we had a lot of fun conversations about stories they had trying to date with cancer. So I encourage you to talk with your AYAs about dating and how that's going, and see if you can provide support to them around that. So support from their loved one and peers is often very important, but also reducing that suffering on their loved ones. And many young adults have children when they're diagnosed or have a child after they're diagnosed. And so helping them to create this support network for their children is very important. Give it a sense of purpose, right? Completing education, finding a job, or a volunteer role that is of meaning to them. For many, it's getting married and having a family. Others, it's finding, and for all, it seems, why did cancer happen to me? What does this mean about me in my life? Few people in this age group are very religious. As we know, just a national trend here in the US, that it's not a time period developmentally where religion is important, but spirituality, nature, and pets did come up as something that gave folks a sense of purpose. So we talk a lot about goals and what's important. And just because you have cancer doesn't mean that you need to stop having goals. And I think it's something that folks are afraid to have goals and to set goals, not knowing what's going to happen. And that is absolutely realistic, and something that could be a way to approach the topic. And then maybe this is something you're hesitant to do, not knowing what the future will hold, but encouraging folks to have goals, reframe maybe some of their bigger goals. Maybe they can't get a PhD, but maybe they want to take a couple courses in something that really stimulates their mind and gives them a sense of purpose and meaning. And then a lot of folks want to look to be connected to resources. So that's internal, like how can I find ways to cope in a positive, healthy way? How can I build relationships both in the cancer survivor community and outside? Because oftentimes when you're diagnosed with cancer at this age, it's a very social age group these days. And so most folks learn about it. So there's no way to get away from people knowing that you have cancer. So how can you help them redefine who they are as a cancer survivor in their previous communities? And maybe that is not an interest anymore, but help them to build community and build relationships to help them through their treatment in terms of supportive and healthcare relationships. So really important in this age group is to have a sense of personal agency. Adolescents and young adults, parents, if they are still around and involved in their life, really kind of swoop in as I would imagine I would if my child were diagnosed with cancer, wanting to be there to take care of everything and to make sure they were safe and healthy and living as long as they could. But for a lot of AYAs, that's so frustrating because they want to be able to do this. I talked with a young man who I thought was super cool. And he said, you know what, I told my family they can only ask me questions on Friday. And so I will make them dinner and they can ask me all the questions you want, but every other day of the week, I don't want to talk about it. And that was his way of finding control and setting boundaries. Maybe that doesn't work for every family. And he said it worked for about 4 weeks, but that got him through the hurdle of those initial unknowns. So, how can you help folks find control over their lives? And with the time that they have, how do you help them reframe their goals to do things that are important to them? So, some ideas for supporting AYAs, looking at communication strategies, asking them, what works well for them? Do you like to receive text? Do you like to receive emails? What kind of things are important for you to talk about? Looking really closely when you're following them, what are the losses? What are they saying they're missing? Also, where are they showing strengths and resilience? Where are they bouncing back from this horrific illness we know? Where are they bouncing back? How can we highlight these strengths they have? Helping them at key transition points. So maybe there are spots at survivorship, as you all know, like after treatment, it's really scary. We're not there as providers or support services to be there every day like we were before. And at end of life, we'll talk a lot about that in a minute. Like, how do you support folks during these key pivotal points where they feel lost and alone? So use of creative expression. I'm going to show you next an intervention that I developed that looks at photography and meaning-centered psychotherapy. That's an online intervention. And then just really, how do we help them connect to others and look at maybe their own internal ways of coping? Mindfulness, self-compassion, yoga. These are really things that are seen as young adults and adolescents as really helpful in their healing. So I learned about a group out of New York that was using photograph and meaning-centered psychotherapy. It's a type of counseling for folks that typically have advanced cancers that talk about like what gives life meaning and purpose and hope. So I went to them, talked about it, and learned that I could take this program and adapt it specifically for young adults. And I offered over Zoom. So we meet for 8 weeks, and each week, each one of the participants brings 2 to 3 photos based on the theme for the week about what's important. And I'll share just a couple here from you. As you can tell, the red devil chemo over here on the left. A young woman, and by the way, I have permission to share their stories and photos, but she was saying living with cancer is essentially learning to balance fighting for your life and actually living your life. She was diagnosed with a metastatic cancer and she will be on chemotherapy the rest of her life in probably a short period of time. So this is what it's like for her, having a small child and a husband and managing treatment together. In the middle is a young woman who was diagnosed with breast cancer. This is in a mammography unit area, who didn't talk about her cancer, did not feel like how she could connect it to her life. And a year after her treatment, the group, she said, helped her to begin to integrate this story. And so now she talks about it. She's like takes this picture and posts it on Instagram. She'll share with people about what it's like now. And so the last one is a picture, as you all, maybe if you work in radiation, or have gone through it, like how important it is, just kind of like prison, marking off the days of when things will finish. So this is, the question was things that they're proud of. So she shared this aspect. So just a couple of things. So this group is open. If you have any YAs young YAs 18 to 39 you think would enjoy photo voice, let me know. I'll share my email. We are taking folks for that group. So I'm going to transition now to talking about advanced care planning and how to support AYAs and their families, and talking about what matters most in life and matters about treatment. So I don't know if you've read, but this is a kind of a Sentinel article published about AYAs, and particularly actually more, I should say, children and adolescents, but it's Pediatric and Blood Cancer is the journal, but it's the psychosocial standards of care for children with cancer and their families. It's amazing. It's 15 sets of standards that all systems should hopefully engage in their care, but we found tons of gaps that related to psychosocial care, in particular palliative care and bereavement and end of life. So we know youth with cancers in their family should routinely receive systematic assessments of their psychosocial healthcare needs. They should be able to access psychosocial support and interventions throughout their treatment and access psychology and psychiatry as needed. That those psychology and psychiatry are very limited. Many institutions do not have either. And youth with cancer and their families should be introduced to palliative care concepts to reduce suffering and should receive developmentally appropriate end-of-life care. And just in case, palliative care is a intervention or it's a model of care that looks at reducing symptom burden. That could be physical, emotional, or spiritual. I hope I'm going okay and not too fast. You all are hanging with me. So I think maybe you all have heard a lot of people say, hey, have you thought about do you have a will? Do you have a living will? Have you thought about what's important to you in your healthcare? We talk about this a lot as adults. I encourage even my students to do it who are, in their 20s and 30s. But it's really important to have these conversations with folks that are developmentally able to have these conversations. So with adolescents and young adults, this is possible. You can tone them to their developmental level, but it's important to ask them what is important to them about their life. So difference between advanced care planning and advanced directives. So advanced care planning looks at a meaning making and legacy work, considerations of what matters most in their life. What do they hope for? What for those that are caring for them and their loved ones? What message, what items do they want to leave behind? Our advanced directives often are these like tangible documents, a living will, a durable power of attorney for health care, the provider orders for life-sustaining support. It depends on your state. Some folks have MOLST, some states have POLST, maybe different where folks are from in different countries as well. But these documents help to start these conversations. So we talked about what are the developmental stage is the person at, and I'll talk a little bit more about that as we're going along here as I'm talking, sorry. Thinking about as well loss of control over physical and emotional well-being. I cannot tell you, I can tell you, but how I was stunned by the amount of panic attacks and persistent panic attacks and anxiety and depression. And being an oncology social worker for 20 years, I thought I had an idea about the depth of it, but being one-on-one in a research interview, interestingly enough, I was able to dig even deeper into some of these aspects of anxiety and depression. So isolation, we talk about that a lot. How can we help them in talking about advanced care planning? How can we encourage socialization in that? How can we encourage them to reach out to their peers in these dialogues? And importantly is a need to have control over their healthcare decisions. Although folks, who are 12 and 13, different states will have different legal perspectives, but encourage them to have a voice. What is important? Encourage their guardians to listen to what it is that they want and need. So what do we know about, there's not a ton of research, but what do we know about decision-making with adolescents in terms of end-of-life care and treatment? We know that family members might not always understand when adolescents want to have these conversations. because parents want to protect their children. They want to keep the sense of hope, right? So we know that 80% of adolescents desire to have earlier conversations. So early in their treatment, want to talk about what's important to them. And only 39% of the families interviewed or understood that that was important to them. So there's definitely a mismatch in what families think and what youth want. So families know that they want honest answers from their physician and that their children want information about treatment options. And they also know really well about their understanding of what their child wants in terms of the natural death process. So in terms of young adults, we know that they often become dependent on their parents, often have to move back home due to finances for treatment, transportation for treatment. In this age group, they have very little acquired wealth or savings to be able to afford moving out and staying on their own. So they often have to shift back with their parents. So parents become a part of this decision-making process, whether they want them to be or not. This is a very developmental incongruent stage to be a young adult or an adolescent that has a body that feels like it's 85, but they mentally and emotionally and existentially feel like they are an adolescent or young adult. And so caregivers and families and friends are very important. We need to include them, but we need to ask the young adult how they want to be included in these conversations. And if they have children, if they are a young adult or an adolescent that has a child, we need to understand how we can help them better care for their children. And especially if they are single and don't have family, how that child, if they should die, how that child would be cared for. So what we know about AYA's preference for having advanced care planning conversations, they value their voice and their decisions. They want to be cared for and supported throughout their illness, right? Who wouldn't, right? They are most concerned about the individuals that they're leaving behind. So it's a sense of selflessness that shows up. I see this a lot in working with youth as well, young children that have cancer, that they wait to die until they know that their family is ready. And they are at a place where they can cope with what's going on to the best of their abilities. And the forms need to be super easy, open-ended, and minimally stressful if you're filling out these advanced directive documents. When talking with the A's, they want to start with comfort and support. They want to know, in terms of treatment, they want to know how long it's going to be. They want to know what the side effects are. They want to know options. Is there a treatment that has less side effects so I can continue my social life and going on in that way? They want to be able to complete it at home and be able to think it through. They don't want to fill it out in the office and have to go. They want to be able to come back and ask questions and to talk this through. And they also want to know that it can be revised. It's not a one-time thing. You can change it. Many of you may know the 5 Wishes. This is a similar document called Voicing My Choices. It's a planning guide for adolescents, young adults. So you'll see these are the key points about being supported and not feeling alone. Again, the sense of isolation. They want to feel like they're not dying alone. They want to be comforted. They want to have people know what decisions they want, the type of support treatment they want or don't want, what they want their friends and family to know about them. This is really key. And a lot of folks write in here what they want to leave behind. So some folks, young folks, it may be a photograph. It may be a piece of art that they did. It may be a favorite clothing item. It may be a stuffed animal. It's finding out what it is and who they want to leave things to. They might not have a formal will, but there might be some things that are of value and meaning to them that they want to share. So these are things that are in the 5 Wishes. They don't have to fill them all out. So many folks may wonder, well, how do I even start this conversation, right? How do I have this so I don't feel like I am telling them that they're going to die? How do I have this conversation so they don't think that I know something that they don't and that their treatment isn't working and that I know this and they don't? So really, I think it is planting these seeds early. As a palliative care social worker, let's have these conversations early. And so it's presenting both sides, right? we're hopeful that your treatment will be effective, but we also want to make sure that we understand your wishes should your treatment not go as expected. We've learned that many people your age have found it valuable to have a say in what they want or not want if treatment doesn't go as expected. I'd love to take a moment to gather your thoughts on how we can support you in making sure we respect your wishes. So, obviously, you can do this in a language that feels natural coming off your tongue. But I think what's most important is being able to balance this, that we are in the same thing as you. Our goal is to help you find a cure. And sometimes we're not able to do that. And should that happen, we need to know what is important to you. When do you want us to have conversations to let you know when things are going to shift and change? I have found that folks want to know, folks want to have these conversations. And if they don't want to know, then they'll let you know. So create this as an invitation. Is it okay if we talk about this? Or when would be a better time? But we found having these conversations with an adolescent and their parent that things change because of these conversations. There's a reduction in anxiety. Their school quality of life scores improve, interestingly, right? That they're not worried about this and taking them wherever they go. Spiritual measures report an increased sense of peace in being able to have these conversations. They have more satisfaction with their communication with their providers. And they also had this great sense of, well, there was an counting more advanced directives were completed when we have these conversations. So it just shows that starting these dialogues can have an impact in every aspect of their life. So some implications to think about, right? We want to think about how do we navigate the differences between a parent and an adolescent or young adult as a patient. So oftentimes their needs can be very different. So how do we help navigate the two differences? And I found clinically for me, that was the hardest part. When my AYAs were done with treatment, they didn't want any more and the parent wanted to keep going. So it's being able to have those conversations and share where everyone is at. We need to acknowledge loss. We need to be very open about it and say, can you tell me about your losses? Do you feel like you're grieving? And talk about how this really is a loss. Being able to help balance hope and really hope and reality at the same time, just like we were talking about wanting to help them find a cure or to treat their cancer so that it's not such a burden, but recognize we always can't. But this is what you're hoping for. What do you want? And what are the small things we can do maybe to help you get there? So maybe goals don't need to be as big, but hope for smaller things. Reframing, what would you like to see happen this week? So keeping it more in the immediate time can help those goals automatically shift and reframe. Social connection, social connection, social connection. And I'll share some resources for that for you. But that is where I saw and have seen is a sense of meaning making happen. A sense of purpose happens when AYAs are able to connect to other AYAs and to be a mentor, to be able to say, hey, you're not a case scenario. I've been through this too. You can do this. So that I encourage you to connect to folks and explore what matters most and gives life meaning. Some tips, right? Model honest talk with them. Be honest, be transparent about your own feelings. Maybe if this is a hard conversation to have, it's hard for me to bring this up, but it's really important that you know that I'm here for you and I want to know what's important to you. Allow AYAs to have control in their healthcare, to talk about their end-of-life concerns, plant these seeds early on in conversations, and bring in the family. Let's figure out what they are feeling and what they are thinking as well, if the youth wants you to do such. Check with the AYAs to determine what for them is the best time for their conversations, present options for treatment, and allow time for discussion and their ability to change their mind. So don't, unless it's obviously an urgent need, but encourage them to think about what options are available, to go home and to ponder that. Have time where they can talk to you without their parents or family in the room. Because you want to know what it is they're feeling. And sometimes they're afraid to have this conversation, and you can be the broker and to give them ways to have the conversation, or you can be there and help them have this dialogue between them and be a supporter and foster of that. So yes, communication. Is it best by email? Is it best by text? What works for your AYA to communicate with you and within your health system or your support system, HIPAA compliance concerns? And always remember, if you're treating a young adult, to ask if they have children. Was not on any of my intake forms when I was in practice. Hopefully things are better now, but encourage them to have a conversation. Do they have children? What are their children's needs? So here are some resources available to you. I tried to group them, so hopefully it worked. So psychosocial support services, Stupid Cancer has their CancerCon every year, and then they have great resources available virtual throughout the year. Teen Cancer for our younger folks. Canteen is a program out of Australia, and they have unbelievable programming and resource information that is very appropriate to the age group. So it's teens, AYAs. So Canteen, I love them. Lacuna Loft is now Cancer Cactus Society. That's a great organization for folks, as is Elephants in Tea, that like to reach out and express through art and word, through journals and things like that. Super Sibs, making sure these siblings have a voice and say. Wonders and Worries is looking out for children. Jack and Jill Late Stage Cancer Foundation provides resources for like Make-A-Wish for adolescents and young adults who are at end of life that have children. So it helps their kids to have cancer as related to employment and legal stuff, cancer cares. American Cancer Society helps track all of college scholarships. So let AYAs know that because they have gotten cancer, that's one of the tokens that one can get to help scholarships for college. And then groups like Epic Experience, Camp Koru, First Descents, those kinds of groups help with physical activity, outdoor stuff. So, sorry, resources, these will be in your PDF so you can dig deeper. And this is me. And I hate rambling without hearing voices, so I'm going to stop sharing. That's me. Any questions, concerns? Did this bring up stuff for you in your work?
Yes, I just reminded folks to please post their questions in the chat. And as you were talking, first of all, I want to say thank you, Jen. That was very, very helpful information as I think about the work that I do with young women dealing with ovarian cancer. There were a couple things that came up, and while we're waiting for other questions to get posted, that I would like to share is I've had the experience where the young survivor was discouraged from thinking about their mortality. They had cheerleaders in their life, whether family or friends, who said, don't even think that way, you're going to be fine, you're strong. You know, a number of things that they would say to tell the person that they needed to just focus on being cured and not thinking about their mortality. How do you find that shows up in your work and your experience with this group?
Quite a bit. Yes. And I think as healthcare providers, oftentimes physicians set that tone too, that they don't want to talk about their not ever being an option. And I have found that this population, except for I think pediatric oncologists have a different way of really taking this on from the get-go. But I find that typically adult providers have a hard time thinking about death and dying with a young adult population. So they're not wanting to have these dialogues themselves. And so they set that tone for the family that we'll always have options. We'll be able to treat this. And so I think from the physician office, even when the first couple of visits, letting it know to talk about questions, concerns. Let's talk about these grief, the losses that you're having. How has life changed? What does this bring up for you? Do you have fears? So having people in the office that are comfortable having these conversations sets the tone.
Mhm.
Also having time for the AYA to be alone with you. So maybe send the parents out to get some ice or, to the gift shop to get something that takes 10 or 15 minutes, but to be able to, see if you can have some time alone to see if there's anything they're afraid to talk about.
Okay, yes, that's very helpful. Sarah is asking, do you have any resources or recommendations for families where a parent has terminal cancer diagnosis and they don't want to disclose the terminal part of the diagnosis to the child or teen? Typically, we see it in the context of wanting to protect the child or they fear the child will internalize this info and become sick themselves, either with stress or physical illness. So this is more from the position, I think, of a parent. But do you have some thoughts about that?
I do. I got to work with a great group, and maybe I didn't mention them in my resources called Wonders and Worries. They are out of the Austin, Texas area, and they're hoping to expand at least before the pandemic. But they have all kinds of resources for parents who have chronic or life-limiting or terminal illnesses that they have available. So they have a great resource page. I'll put it in the chat too, just in case it makes it easier.
Oh, that's good. That would be helpful.
So they are there, and they always encourage folks to have these conversations because we know, what is the saying, little pictures have big ears, that they're seeing changes. So oftentimes when I was talking with YAs that have kids, I said that, so maybe they probably recognize, maybe they're not wanting to go to school in the morning, or maybe they're not eating as much, or their grades are changing. They're hearing these conversations, they're sensing our distress, and so they know what's happening. So when they don't know, they create stories, as we all do. We create stories about what is happening, and oftentimes we'll create guilt. I did something wrong, that's why my parents aren't speaking to me, or why they're mad or upset. So I always have found that having conversations that are developmentally appropriate with them about what it is, and that you as a parent are going to do everything you can to be there and to be there with them. But oftentimes there isn't always an answer to it, or a way to fix it. But that, as a mom or a dad, that we're going to start building resources to make sure that they are okay. I think the most important thing is to make sure they have a safe space where they know they can go talk to someone, have a safe person designated, maybe it's a aunt or uncle or a neighbor or somebody in the, a volunteer or church community, where they can talk and also keep their life as regular as possible. So if they are into sports and activities, help, now that we can hopefully in many places do these things again, make sure they can keep their routine. That's really important.
Yeah. And I think some of the challenges are also around whether or not a child gets to see a parent cry or feel worried or sad, and that they try to put on this brave face. And I think, even young people with cancer do this for their family when they're the child of a parent who is taking care of them, or has taken them in. And so how do your participants in your programs tend to talk about their willingness to expose those vulnerable emotions?
Great, that's a great question. That oftentimes the extreme of emotions they try and not show to children, or to wait a day or two after they receive a big hard news, so that they're not as emotionally intense about it, or an emotional crisis where they've had time to process and think this through. But I think, showing feelings, about modeling behavior is really important. And a lot of parents showed me that. Interestingly, I had a young man I talked to that was a chap or a minister. And he said, he hates that his children had to see this, but if there was any benefit from this, that they learned that they could go through this, that they learned they could ask for help. They learned that cancer is bad, but that you can get through it. And that, he said, it sounds weird, but he's glad his children had the opportunity to see this. And I thought, oh, but it's true, right? So they're learning it's okay. If you're as a parent, ask for help and get counseling, that kids learn it's okay to talk about your feelings. It's okay as a family to talk about feelings. So when something scary does happen, they feel okay that they could bring it up as a child.
Yeah. And another question came in. Can you please say again the name of the ACP resource you mentioned, the one that is similar to the 5 wishes, but for AYA?
Yeah, let's see if I can cut and paste this. It's voicing my choice. Okay. It is called Voicing My Choices. Let me put it in the chat here.
And is there a cost for that document?
I think there is, but you probably could find a PDF online. Google Images, I always tend to go and look and see if I can find one that has the key points. It's very different from the 5 wishes. 5 wishes is kind of flat and light blue and white. This has more art in it. It's more green and colorful, and it just feels a lot more hopeful. There is research done whether you could use 5 wishes with young adults, and they preferred this over the 5 wishes. It felt it fit more to what their needs were.
Okay.
You could use 5 wishes as well if that's what you had. So there is, I think you can buy them in bulk as well.
Okay. And Becky just posted a link to 5 wishes. Becky, is that the one for adults or the Voicing My Choices?
Looks like it's for, Voicing My Choices. So it's a sample PDF that you can, if you click on that, it should take you straight to the PDF.
Wonderful. Thank you. Thank you. Another question came in. Do you have an experience with multidisciplinary family meetings, and can you talk about that?
Yeah, I'm trying to think. With family with the kids in, mostly I have with the parents, or as a young adult and their older relative. I do a lot of family meetings, but it's usually not with the whole team, with the kiddos involved. Yeah, is there a specific part about it or questions you want to know or how to do it? Do you have anything in particular?
Shlomit, do you want to? Becky, can they turn on their mic to explain more? Is that okay? So Shlomit, if you want to unmute yourself and ask the question, please feel free to do so.
Now, I want to know if you have an experience with multidisciplinary family meeting, and tell a little bit about the key, because we are trying to develop this intervention with our team, multidisciplinary team, and I think that social worker should lead this intervention. So I want to hear a little bit more about your experience and how you do it, and with the physician, with the nurse, and so on.
Yeah. I was trying to think. Something did come
I
up.
believe that this is a very important. All the family, the parents, and the kids, and all the staff. Not all the staff, but the physician, the social worker, and nurse.
Yeah, very important, right? So everyone is on the same page, or at least everyone knows where everyone is, right?
Yeah.
Very important. We did one thing that was kind of cool that I loved. We started a group called Connect for Kids, and parents would drop their kids off after school, and we would do some basic information about like how they were coping, and games and activities and drawings. But then we would have a couple nights where we would do, or weekend days where we would do visits at the hospital, and they would come in and take tours, and the doctors would lead the tours, and the nurses would be there, and the radiation therapists would be there. And so it was kind of a non-intimidating, if possible, way, because you sync the kids and we're like, oh, how cool, look at that neat radiation machine, or this is what the hospital bed looks like, or this is where mom or dad's getting chemo. And so they feel like they're more a part of the process when they can see, because oftentimes they have to stay at home. So if you do it on the weekends when there aren't as many folks there, they can see what it's like and feel like they have a part of it. And then the doctor doesn't seem so scary because they come in like their weekend clothes, and they're, if you have the doctor that can speak to kids, right? Sometimes it might be total backfire with some physicians, right? Or maybe there's a nurse practitioner or a nurse that wants to lead the tour. But just having that opportunity, and then they can ask questions, and then the doctors will give out a couple ideas of like questions and make them like fun and non-threatening, and you'll be surprised at the intensity of the questions that the kids will ask, because you create this safe environment where they feel like they're actually part of the team. So I don't know, maybe something like that where you could have a kickoff to, or like an open house kind of thing would be a neat way to do that.
Yes. It sounds very similar also in the kind of communication style with the interdisciplinary team, I can't say that very clearly, that palliative care might offer.
Yes.
In some settings too. So it would be nice.
Yeah.
All right. Any other questions in the last moment we have? While we're waiting to see if anything else is posted, I just want to check, do you have any book recommendations that adolescents or young adults like to read that help them find meaning in their experience or adjust to their diagnosis and treatment?
I don't know of those, but I bet that I hear more about writing and sharing their own story. So like Elephants in Tea and Cancer Cactus organization, they are the best at like sharing their message out. And my guess is they would have, they have a lot of newsletters that folks can read, and books and writings that others have shared their memos, or their narratives that I think folks find really helpful. So those websites could have some messages that they would like.
Wonderful. Well, thank you so much for this presentation. It was so informative and helpful with regard to understanding how best to reach this population and support them in effective ways, as well as with some tips about how effectively to introduce the advanced care planning need and benefit for them. So thank you all. Once again, this recording will be available at the Colorado Cancer Coalition website. It's Colorado Cancer Coalition, all one word, .org, and look for the tab that says webinars, and it should be available in about 10 days, 2 weeks. So thank you again. Take care, everyone. And thank you for all you do. Bye.
Thank you so much.